Kidney trouble rarely knocks before it enters. Most people who end up with serious kidney damage never felt a thing until a huge portion of their function was already gone. And what's unsettling is that the process usually starts long before any warning signs appear, buried inside habits that seem completely ordinary. I'm Dr. Wilson, and I've spent the better part of the last 10 years working frontline emergency medicine. In that time, I've seen an enormous number of patients arrive with kidney complications that, looking back, had years of quiet buildup behind them. What keeps me interested in this topic isn't only the science of it, but the repeating patterns, the same overlooked habits, the same misunderstandings, the same gradual erosion that nobody notices until the problem is already serious. So in this video, I want to walk you through what years of clinical experience have taught me, in hopes that it helps you protect your health for the long run. And if this information turns out to be useful to you, I'd really appreciate it if you considered subscribing, since it helps this content reach more people who could use it. Here's what makes kidney damage so difficult to catch early. Each kidney contains roughly 1 million microscopic filtering structures called nephrons, and they're built with an extraordinary amount of backup capacity. In fact, you can lose the majority of your total kidney function, somewhere around 60 to 70%, before you'd ever notice a symptom. That built-in redundancy is a remarkable survival feature, but it also creates a serious blind spot. People feel completely normal while their kidneys are silently declining underneath the surface. In my own practice, I routinely check kidney markers on patients coming through the emergency department, and honestly, finding a fully normal kidney panel in anyone past their 50th birthday has become the exception rather than the rule. So today, I want to walk through 6 everyday factors that slowly wear these organs down, and I'll break down what's actually happening inside your body at each step. Stick around until the 4th one, because I'm going to clear up a widely repeated myth about salt that even plenty of physicians get wrong. Let's start with something most people would never suspect: the over-the-counter pain relievers sitting in nearly every medicine cabinet. I'm talking about anti-inflammatory medications like ibuprofen, naproxen, and diclofenac. These are used constantly. Headache? Reach for ibuprofen. Sore back? Same thing. Achy after a workout? People take these things like clockwork. And honestly, I understand the appeal. For some people, including plenty of my own patients, acetaminophen just doesn't cut it, and ibuprofen is the only thing that actually works. But here's the mechanism worth understanding. Your kidneys depend on a group of signaling molecules called prostaglandins to keep blood flowing properly through them. These molecules tell the small vessels feeding your kidneys' filtering units to stay open, which keeps internal pressure stable and filtration running the way it should. When you take an anti-inflammatory medication, you're blocking the enzyme responsible for producing those prostaglandins. As a result, those vessels tighten, blood flow into the kidney drops, and the filtration rate falls with it. For most otherwise healthy people who take these occasionally, this isn't something to worry about. The kidneys bounce back quickly. But layer in chronic dehydration, regular use over more than a week at a time, older age, or existing high blood pressure, and you've created ideal conditions for sudden kidney injury. What makes this especially dangerous is a combination doctors sometimes call the triple threat. When someone is taking an anti-inflammatory pain reliever alongside a blood pressure medication like an ACE inhibitor plus a diuretic. Individually, each of these affects kidney blood flow in a minor way. Together, they can cause real harm. And I see this exact combination in patients far more often than you'd expect. What happens is the kidney tissue becomes starved of oxygen, and repeated episodes of this leave lasting scar tissue behind. Next on the list, and arguably the single biggest contributor to kidney disease worldwide, is uncontrolled high blood pressure. Something a lot of people don't realize is that elevated blood pressure isn't just a symptom of kidney trouble. It's actively one of the causes. Your kidneys are essentially high-pressure filtration systems by design, with blood forced through at significant pressure to push waste and fluid through those tiny filtering structures. When blood pressure stays chronically elevated, you're pushing far too much force through these delicate tissues. The walls of the glomeruli, the microscopic filtering units inside each nephron, begin to thicken and scar in response, a process doctors refer to as glomerulosclerosis. As that scarring builds, proteins that should stay locked inside your bloodstream start leaking into your urine, and individual nephrons begin dying off one by one. Here's where things spiral further, because the nephrons that remain healthy have to pick up the slack. They start filtering more blood at higher internal pressures, which speeds up their own deterioration. This sets off a vicious cycle, since damaged kidneys can no longer properly regulate blood pressure, a function they're directly responsible for through hormonal signaling. Poor regulation drives blood pressure even higher, which causes further kidney damage, which worsens blood pressure control all over again. Research shows that once someone already has some degree of kidney impairment, keeping blood pressure above roughly 130/80 meaningfully speeds the march toward complete kidney failure. Third on the list is something that sounds almost too minor to matter: persistent, low-grade dehydration. Not the severe kind that lands someone in the hospital, but the slow, chronic underhydration that stretches across months and years. Honestly, I see this constantly in older relatives of my own patients, people who simply never developed the habit of drinking enough throughout the day. When your body doesn't take in enough fluid, your blood volume drops slightly, which means less blood reaches your kidneys. Your body responds by activating a hormonal pathway known as the renin-angiotensin-aldosterone system, a mechanism designed to conserve water and stabilize blood pressure during genuine short-term dehydration. But when that system stays switched on chronically, there are consequences. The hormones involved cause blood vessels, including those inside your kidneys, to constrict. That narrowing raises internal kidney pressure while simultaneously cutting down overall blood flow. And over time, this contributes to fibrosis, essentially permanent scarring of kidney tissue. On top of that, concentrated urine from ongoing underhydration raises your risk of forming kidney stones, which rank among the more excruciating things a person can experience. Recurring stones can physically block the flow of urine, creating backward pressure that destroys nephrons from within. None of this means you need to force down excessive amounts of water. Overhydration carries its own risks and isn't the goal here. But if you know you barely drink anything through the day, adding a couple of extra glasses of fluid and getting your kidney markers checked periodically is a reasonable and simple step. Now for the fourth item, which touches on something genuinely misunderstood: sodium intake from heavily processed foods. Salt itself doesn't directly damage kidney tissue. The harm travels a more roundabout path, though it's no less destructive. Here's the piece most people miss about sodium and blood pressure. Your kidneys are the primary regulators of blood pressure precisely because they control how much sodium your body holds on to. In a metabolically healthy system, this works beautifully. You eat something salty, your blood volume rises slightly, your kidneys sense the change and flush out the extra sodium, and pressure returns to normal, a clean, self-correcting loop. But in a person with underlying metabolic dysfunction, that loop breaks down. When insulin levels run chronically high, which happens with insulin resistance and a diet heavy in refined carbohydrates, insulin itself signals the kidneys to hold on to sodium rather than release it. This isn't a brief, passing effect. It persists. The kidneys lose their ability to excrete sodium normally. Blood volume stays elevated, and that same renin-angiotensin-aldosterone system I mentioned earlier gets activated again, locking in a state of sustained high pressure. The real takeaway is that the issue isn't dietary salt on its own. It's hormonally driven sodium retention rooted in metabolic dysfunction. Two people can eat identical amounts of salt and have entirely different blood pressure responses depending on how insulin sensitive they are. The person with insulin resistance retains more sodium, holds on to more fluid, and experiences greater internal kidney pressure from that exact same plate of food. Beyond sodium, heavily processed foods bring additional baggage. They drive insulin resistance and low-grade systemic inflammation, both of which impair blood vessel function throughout the body, kidneys included. Sensitivity to sodium varies enormously from person to person, largely tracking with metabolic health. Some people's blood pressure barely moves with salt intake, while others react strongly. But combine high sodium intake with existing insulin resistance and elevated blood pressure, and you've built the perfect storm for accelerated nephron loss. Most people take in roughly double the recommended sodium intake, and the bulk of it comes from packaged and processed foods rather than the salt shaker at home. In someone metabolically healthy, that extra sodium usually gets cleared out efficiently. In someone with insulin resistance, it gets retained instead, and when retention turns chronic, so does the elevated pressure, and chronic pressure is exactly what wears kidneys down over time. Moving to the fifth factor, and in my view, the most consequential one on this entire list, poorly controlled blood sugar. Type 2 diabetes, driven largely by the same insulin resistance we just discussed, damages kidneys through several overlapping pathways at once. Chronically elevated blood sugar doesn't simply circulate harmlessly. Glucose molecules bind to proteins in a process called glycation, forming compounds known as advanced glycation end products. These damaged proteins build up within the delicate basement membrane of the glomeruli, causing it to thicken abnormally. Specialized filtering cells called podocytes become injured and start dying off, while the supporting structural tissue expands and stops functioning properly. In the earliest stages, the kidneys actually respond by increasing their filtration rate. That might sound like a positive adaptation, but it's really a stress response. The added pressure and workload only accelerate the underlying damage. Eventually, proteins begin leaking into the urine, first in tiny trace amounts known as microalbuminuria, later in much larger quantities, and kidney function starts a measurable decline. What makes this especially relevant for long-term health is that insulin resistance, the true root cause behind type 2 diabetes, typically develops years before an official diagnosis is made. During that extended pre-diabetic window, the kidneys are already absorbing the effects of elevated blood sugar and metabolic strain. That's why getting ahead of blood sugar issues early, well before an official diabetes diagnosis, protects these organs in ways that medication alone often can't fully replicate later on. The key lab marker here is HbA1c, which reflects your average blood sugar over roughly the past 3 months, and any physician can order this test. Finally, the sixth factor, and this one needs some real nuance because it's often misunderstood, very high protein intake, but specifically in people who are already vulnerable. That word, vulnerable, matters enormously here. Let me be upfront. Healthy kidneys generally handle high-protein diets without any issue. If you're young, active, and otherwise healthy, using protein supplements regularly is unlikely to cause you harm. The concern arises in specific circumstances that many people fall into without realizing it. When you eat protein, your kidneys have to filter out the resulting waste product, primarily urea. Higher protein intake increases that workload, which raises internal filtration pressure. In a young, healthy person with normal blood pressure and no metabolic complications, that extra pressure is handled without difficulty. But add an existing kidney disease, diabetes, high blood pressure, or simply advanced age, and that same extra workload becomes a real problem. The mechanism circles back to that same hyperfiltration concept. Remaining healthy nephrons compensate for damaged ones by filtering more blood at higher pressure, and heavy protein intake amplifies that compensatory strain. Over time, sustained high pressure wears down the nephrons that are still functioning. This doesn't mean protein should be avoided altogether. For most people, adequate protein remains essential for maintaining muscle, supporting metabolic health, and promoting long-term vitality. The issue is entirely about context. If kidney function is already compromised, or if diabetes or blood pressure aren't well controlled, then very high protein intake could speed up further decline. Matching protein intake to your actual kidney health, ideally based on an actual blood test, is the safest approach, and that's a conversation worth having with your physician. For the overwhelming majority of people without significant kidney impairment, typical protein recommendations remain perfectly safe. Looking across all 6 of these factors together, a clear pattern emerges. Every single one causes harm through the same handful of mechanisms: elevated internal pressure within the glomeruli, inflammation, oxidative stress, or fibrosis. Kidney failure isn't some random stroke of bad luck. It's the cumulative result of mechanical and metabolic strain repeated over and over across years and decades. Anti-inflammatory pain relievers cut off protective blood flow. Chronic high blood pressure creates excessive internal force. Ongoing dehydration triggers damaging hormonal cascades. Sodium raises blood pressure through insulin-driven retention. Diabetes physically damages filtering structures. An excessive protein intake increases workload on kidneys that are already struggling. Different pathways, same destination, nephrons breaking down one by one. So what's actually worth doing with all of this? If you fall into a higher risk category, whether that's diabetes, high blood pressure, a family history of kidney disease, or simply being past 60, regular monitoring matters. That means checking blood pressure consistently, generally aiming to stay under 130/80 unless your doctor advises otherwise for your specific situation. It means annual blood work to assess kidney function, along with a urine test checking the albumin to creatinine ratio, since these catch early damage while it's often still reversible. It also means being cautious with regular anti-inflammatory use unless your physician has specifically recommended it, staying reasonably well hydrated without fixating on arbitrary water goals, and cutting back on heavily processed foods, which helps lower sodium intake, improve blood sugar control, and reduce inflammation all at once. Getting ahead of blood sugar issues early, long before a diabetes diagnosis, protects these organs in ways that are hard to reverse later. And if kidney disease is already present, working with your doctor on an appropriate protein intake matters more than following generic advice. At the end of the day, your kidneys are vascular organs through and through. The same habits that protect your heart and your brain are the ones protecting your kidneys as well. Steady blood pressure, strong metabolic health, and lower inflammation throughout the body. These aren't separate goals pulling in different directions. They're deeply connected, and taking care of one goes a long way toward taking care of them all.